I am honoured this morning to have on the phone the Director of Public Health, Dr Nicola Brink. Good morning, Nicola.
Good morning.
How are you today?
I'm very well, thanks.
Now, Nicola, first thing I want to ask is, am we calling you Nicola, Dr Brink, Nikki? Which one are we going for?
Nicola's fine.
Okay, right, I'll stick with that then. Now, first of all, Nicola, we're down to zero cases now across the bailiwick. You must be so proud.
We're extremely pleased. It's exceeded our expectations. So from our point of view is we didn't expect to be in the position that we're in today. And I think it's a fantastic achievement for the entire island. So this has really been a whole island effort. It's been a whole community effort. And from my perspective, is working with public health, with pathology services, health and social care, states of Guernsey, with our Deputy Salisbury, Deputy St Pierre, but also most importantly with the community of Guernsey has enabled us to get where we are. And it's a really good place to be, but I would also just caution against complacency. We're in a great position, and now we mustn't lose that good place. So I think that's really important as we move forward. We've got to keep the public health advice going. So we will be issuing more guidance on social distancing as we move forward into phase 4, just reinforcing hand hygiene, respiratory etiquette, catch-up etiquette, all of that's so important.
So we have moved on incredibly quickly with what's been going on, and it went up, we got to the top of the curve, then we've come down very quickly. We're going out. Pete, do you think, are we worried a little bit that we might be moving a bit too fast?
We always sense check our data not only by looking at the numbers of new cases, and we've had no new cases, so in fact you're the first press to know that we're day 28 today with no new cases.
Amazing.
So we've just looked at our overnight results. We report every morning first thing, and we've had no new cases. So we're now day 28 of no new cases. And we look at that, but we also look at when we had our last case of community transmission. So that was on the 21st of April. We then sense check against other clinical parameters. So, for example, I link regularly with my primary care colleagues, and they've no suspected COVID activity in primary care. We speak to the emergency department, and they've had no activity suspicious of COVID. We then look at our inpatients. We have no inpatients with COVID-19. So it's not only just looking at have we diagnosed any cases, but it's also looking at the clinical parameters. On top of that, we've started doing asymptomatic testing last week. So because we exceeded our expectation, we've had so few symptomatic cases, we've been able to start our expanded testing program early. So we've offered testing to emergency department staff, to the ambulance staff, to health and care staff who were looking after COVID-19 patients when we had them in the hospital. And we've offered, this week we're testing all of primary care. And so we're moving through groups of people who are asymptomatic. And again, we're finding no infections. So we think that we've got very little, if any, COVID activity in the bailiwick. But if there is any, as we increase our connectivity with each other, we might get cases bubbling up. And if people are symptomatic, we want them to come forward because we want to test them, and so we can do our test, track and trace, which has been so successful. So I think we're very happy with where we are, but we don't want to be complacent because we could still see cases, and we want to be able to manage those and contain those very quickly.
And you are prepared for a second wave of this coming through?
Oh, yes. So we've prepared for a number of scenarios. So we've prepared for the identification of single cases popping up in the community. We've prepared for clusters of cases, and we're preparing for a second wave. We're also looking beyond that to our winter respiratory virus season and how we integrate COVID-19 testing with, say, for example, our winter flu testing, our testing in winter for another respiratory virus called respiratory syncytial virus. So we're looking at all of that. So we're now planning into next year already. And I think that forward planning is so important, and it's served us well in this pandemic because before we had our first case, we already had contact tracers trained up. So the UK is aiming for 18,000 contact tracers. we've got 36 trained up in Guernsey. So in UK terms, that's 36,000. So it's that preparation is absolutely key to managing respiratory virus infections in general, and certainly for managing a pandemic.
Nicola, I have a few people every so often. Actually, someone spoke to me the other day and said, it's all nonsense. It's all a big ruse. It's a big scare tactic, is this coronavirus. My sister works on the front line up in St Helens at the moment, and she's seen everything that's going on. So I gave that person a little bit of a mouthful. But what do you have to say to people that have this opinion of coronavirus itself?
I would say this can be an extremely serious infection. You've only got to look at what's happened in neighbouring jurisdictions, so in France and Italy, in the UK as well, to see that this can impact really seriously on people's lives. It can kill people, and so it's really important that we have a very proactive approach. So this is a virus that has only recently entered the human race, probably around about November last year. So I think it's really important that we look at how we can control it appropriately, but also be aware that this virus can cause very, very serious illness in certain people, and particularly in vulnerable groups. So people over 70, people with underlying medical problems, pregnant women in the third trimester of pregnancy. So we've got to look at all of those. It's really important.
People are going around wearing gloves as well, Nikki. Obviously, they're trying to protect their hands. For delivery drivers, they're obviously out and about all the time. But for people that are going to the shops, getting their shopping, then getting back in the car again, touching the steering wheel, going home, taking all the shopping out, it's still not helping. They need to wash their hands, don't they?
Yeah, I mean, one of the things that I'm always concerned about is people using gloves or indeed any other form of personal protective equipment as instead of actually adhering to your basic infection control principles. So wearing gloves and then touching everything and touching your face and so on is going to possibly will increase your risk of infection if you don't sanitize and clean your hands properly. So, for example, what I think happens is that people put on gloves and it lulls them into a false sense of security. So, really important, rather than wearing gloves, is that good hand hygiene. Washing your hands is best, but if you can't wash your hands, use a hand sanitizer. So that basic hand hygiene is the most important thing that you can do. Wearing gloves, as I say, can actually lull people into a false sense of security. It means that they don't wash their hands that often, and if you don't, you could actually potentially increase your risk of infection. So going back to your basic principles of hand hygiene is the most important thing. So your hand hygiene, the respiratory etiquette, as we say, is catch it, bin it, kill it. So, if you sneeze into a tissue, dispose of the tissue, wash your hands. That's really important as well.
Nikki, with social distancing, is this a new norm now? Is this going to be here for a while?
I think what's going to happen in the post-coronavirus world, the new normal, whatever term we want to look at, I think we're going to have a increased awareness of infection transmission. And I think this might impact positively on other respiratory viruses, on things like norovirus and so on, of the importance of hand hygiene, of the importance of being aware of your personal space, and of the importance of respiratory etiquette. With social distancing, I don't see us sticking to 2 metres, and in fact we're going to be issuing new guidelines in phase 4, which we're going to have a combination of 1 and 2 metres social distancing, and we're dividing it into what we call controlled and uncontrolled environments. So a controlled environment is where you know who's there, you've got a list of people there, and under those circumstances we'll accept 1 metre social distancing, and in PV that's in line with the World Health Organization. And then in uncontrolled environments, for example, in a supermarket or out and about, we would suggest 2 metres. But going into phase 5, we will then look at not having a fixed social distancing measure, but look at actually saying to people, be aware of your personal space, be aware of your hygiene, and we'll be trying to get back to a more a more normal type of environment. But again, with that awareness of how we can prevent infections, if we can take one positive away, we can look at how we can prevent those respiratory tract infections. That would be good.
Now, you talk about phase 5. I know we're not even phase 4 yet, but are we moving quickly towards phase 5?
I think we need to get into phase 4.
I wanted to be cheeky.
Because I think in phase 4, we're opening up a lot of the island, almost all of the island. And what we're asking people to do is work with us and not be complacent, respect the public health advice. And honestly, people have been so good about working with us. It's one of the things I found so encouraging is everything we put into place, people have said, yes, we understand, and have taken it on. And it's really been a Guernsey Together effort because we've had those discussions. So I think we need to get into phase 4 too. I'm not trying to avoid your question, but I think we need to get into phase 4, see how we go. But if we do go well in phase 4, yes, we will move to phase 5 faster. When we did the exit document, we specifically called it an exit framework. So we didn't say this is a plan, a strategy, tablets of stone, because we wanted the ability to flex either way. So if things started going wrong, we wanted the ability to pull back quite fast. But if things went better, we wanted also the ability to concertina things and move forward faster. And we tried to do all our calculations on science. So, for example, going into phase 4, will be hopefully by Friday, I don't want to tempt fate, but hopefully on Friday will be day 30. So if you look at the maximum generational cycle of the virus, it's 14 days. So we will have been over double the maximum generational cycle of the virus. So we're looking at trying to space it out based on what we know about the virus. And I think that's really important because this is a new situation. We're all dealing with a new virus, trying to look at the evidence as it appears, and it's going back to those basic principles. What's the incubation period? And if your incubation period is 2 to 14 days with a mean of 5.2 days, so let's double that and go up to 28 days. And so that then has given us that additional comfort zone. But as I said, we can't be complacent. We need to be very. Sorry about that.
It's all right.
We need to be very careful about that. So we need to be very careful about making sure that we use evidence to define what we're doing with our incubation, with our moving from one phase to another. So I think that's really important.
I know we've not got too much time because I think you're doing something at 8:30 this morning as well. But I just want to ask a couple more things, if that's all right, Nikki. People ask me, and we talk quite a lot about where you are from. Nikki, your accent sounds like it's all over the place. Where are you from, Nikki?
It is. I was born in Durban in South Africa, and then I went to university in the Cape Province, so in the Western Cape. And then I went over to London, and I worked at University College in London for 13 years before coming to Guernsey. So I think that's probably I think I've picked up a bit of accent from all the places that I've lived in. So I think that's why people find it difficult to place.
And are you married? You got children?
Yes, I've got 2 children, and both of them are, I say unfortunately, in the UK. I haven't seen them for some time, which obviously is difficult. My son is studying medical engineering at Cardiff University, and my daughter is a trainee solicitor and lives in London. So miss them both a lot, but we all need to stick to the rules, don't we?
Indeed we do. And Nikki, one final question. Do you ever sleep? You seem to be working all the time and just constantly on the move, always doing something. And with everything that's going on at the moment, you must be so busy. How do you get a chance to just switch off?
I'm very fortunate in that I've got, obviously, my husband, and I live with my 86-year-old mother lives with us as well. So we love working in the garden. We love spending time in our garden. And I'm one of those people who don't need a lot of sleep. So I only need about 4 to 5 hours sleep a night. So I'm quite fortunate that way.
I have seen some of the times that you've been tweeting messages. It's been like, she's still not asleep. She's still not asleep. Nikki, it's been an absolute pleasure to talk to you. Thank you for everything that you've been doing for the bailiwick.
You're very welcome. As I said, it's been a big team effort.
Well, yeah, exactly. Congratulations to you. And also, there's a team behind you as well, because I saw quite a few of them when I came and delivered some pizzas once before up to you when this all started. But there is a big team behind you as well.
They're a fantastic team. And, these are people that have just gone into working a 7th week without breaking step, so it was, I didn't even have to ask them, which is absolutely amazing. So they've just, by themselves, worked out, working 7 days a week, and if we were to get a positive at 7 this evening, which hopefully we won't, the contact tracers would be in straight away, and we'd be contact tracing within an hour. So I think that's important from that perspective. So it's an amazing team effort, and I think I'm incredibly lucky to work with this team. And I can't tell you how amazing they are. When we had our first case, I turned round and they were all outside my office, and it was, well, come on, we've got our first case. Let's get on with it. They'd all come in. It was over a weekend. So it has been an incredible team effort, but it's also been an incredible effort across the states, or across the whole of the community of Guernsey as well, and that people, every single person on the island has helped with this journey.
Nikki, I think when we finish with all this, we need to have a big party.
Thank you. I would love that.
Nikki, on behalf of me, and also for so many people in Guernsey as well that mention your name, thank you so much for everything that you're doing. You're doing an incredible job, so thank you so much.
You're very welcome. Thank you for the chance to talk to you.
No worries. Nice to speak to you, instead of me facing you in the press conference and not saying anything. Thank you, Nikki. Have a lovely day.
All right. Okay, then. All right.
Bye. And there goes Nikki off to do a little bit of something else. Someone's trying to get through to her on the phone. Don't know who it was. Isn't she amazing?
Yeah.
She's amazing, amazing lady. But thank you so much. And, amazing.